concerns about the safety of the swine flu vaccination and how effective it is at protecting us against the virus.
And with us this morning, we have Dr. Holly Case to let us know what alternatives there are for the vaccines. And so tell us, a lot of people really are concerned about the vaccination right now. So what kinds of things should we be doing to avoid the flu?
Well, there are 5 things that I'm recommending my patients do to boost their immune system. The first thing is having good hygiene practices. The second thing is managing stress. The third is getting a good night's sleep. Fourth thing is eating a healthy, well-balanced diet. And then the fifth thing is consider taking an immune-boosting supplement. So we can go through each of one of those things real fast. I know there's been a lot of talk about the good hygiene practices, washing your hands, especially before you have meals and things. Also managing stress, because highly stressed people tend to get sick more often and stay sick longer.
Yeah, but that's so easier said than done.
Yeah, so if people could just take 5 minutes each day just to unwind, do whatever it is that's relaxing for them, going for a walk, reading a book, whatever, even just 5 minutes I think can really help manage stress.
Okay, are these things as effective as the vaccine?
Well, they work differently, and there's still more information needs to come out about the safety and effectiveness of vaccines, and we are recommending it for people that are at higher risk for complications, such as people that have pre-existing health conditions, asthma, diabetes, pregnant women, that kind of things. But there are things that everybody can do. Even the vaccine is not 100% effective. So there are things that everybody can do to kind of boost their immune system and protect themselves. Eating a healthy, well-balanced diet, getting a good night's sleep. And we need 8 or more hours of sleep a night to really...
Oh yeah, there's that. That's another tough one too.
I know, and most people don't get that much sleep. Most people get more like 6 hours of sleep, and studies show that people that get less than 7 hours of sleep a night are 3 times more likely to catch a cold.
You mentioned something to boost immunity, a supplement. So what should we be taking? We were talking about Airborne, that's advertised all over the place. But what should we be taking?
Right. Well, there are a few things. I mean, there are a lot of different things that could be really helpful. One thing, vitamin D levels are really important for a good immunity. You can have a simple test, 25-hydroxy vitamin D is a blood test that can be done to test your levels of vitamin D. If you're low in vitamin D, supplementing would be really important with vitamin D.
Or just can you go outside, sunlight? Or
well, this time of year, it's wintertime, so we're going to have less sunshine, so less ability to get vitamin D. Also, elderberry and umca are also good herbal supplements that can help boost the immune system.
And they've really proven to do something?
Well, now there's a in vitro study on elderberry showing that there are properties in elderberry that actually bind to the H1N1 virus particles and inhibit infection.
Interesting. Okay.
So what do you personally think about people getting the vaccination for this? Do you think that it's a wise choice for people to do? What would you suggest to your patients?
Well, I'm suggesting the people that are at high risk for developing complications, those are the people that I'm talking about getting the vaccine. I think it's a really individualized thing that we, as doctors, we need to counsel our patients on. And I don't think it's something that everybody needs at this time. We need more information on the safety and effectiveness of it before I can recommend it to everybody.
Okay, and you wanted to talk specifically about the kind of doctor you are, a naturopath.
Yeah, I'm a naturopathic physician, so I'm a primary care physician with a natural approach to medicine. So my goal is to promote the body's natural ability to heal itself through the use of nutrition, homeopathy, herbal medicine, and other natural therapies before recommending drugs and surgery.
Okay.
So then, what is the difference between somebody who practices like you do and then what a doctor, another doctor would do, when he says, you're going to need this vaccination, and someone who prescribes that kind of thing?
Well, we naturopathic physicians can prescribe medications, but we do like to use natural therapies first. We find that they work really well. And also we spend a lot of time really listening to our patients. I spend 90 minutes in the first visit with my patients, really trying to figure out what the underlying cause of their health problem is. And so that, and then using natural therapies to help people be well and stay well.
Okay, well, it's nice to know there are alternatives and other things that are out there, even if it's just to boost your immune system. Thanks so much for coming in.
Thanks, Dr. Case.